athletic therapist is a sports medicine healthcare professional that specializes in the assessment, treatment, and rehab of orthopedic injuries. We're also all sports first responders, so we do sports medicine coverage at games and events, both professional and amateur. We work with sports such as hockey, rodeo, rugby, soccer, gymnastics, and judo. Education for an athletic therapist. We all have a sports first responder certification, a 4-year kinesiology degree, athletic therapy certification, and we're also certified by the Canadian Athletic Therapists Association. Athletic therapy is the prevention, assessment, treatment, and rehabilitation of orthopedic injuries. So injuries such as muscle strains, ligament sprains. We look at like shoulder separations, anything involving the musculoskeletal system. The types of injuries athletic therapists treat are orthopedic injuries. So anything that involves your skeletal system, your muscles, your tendons, ligaments, those sort of injuries, as well as concussions. So some examples might include things like tennis elbow, Achilles ruptures, muscle strains, shoulder separations, osteoarthritis in the knee, hip, or other joints. But to see an athletic therapist, it doesn't have to be an injury per se. You might just be experiencing general pain or want to work on improving your balance, posture, or core. The types of clients that I typically work with vary greatly. I work with anyone from kids to seniors and everything in between. You don't have to be an athlete to see an athletic therapist, although I would consider everyone an athlete because we all do something, whether it's a hobby, a sport, even just, playing with the grandkids on the weekend. With athletic therapy, we're looking to get you not just out of pain, but kind of get you back to your performance levels, whatever that means to you. So get you doing whatever it is you need to be able to do to keep doing the activities you love. So in your first appointment with an athletic therapist, we'll do a full assessment. So we'll take a history of your injury, all the factors surrounding the injury. We'll have a look at your lifestyle, what kind of activities you do and need to be able to do. And then we'll go into an assessment. So we'll do a full assessment of the actual injured area, but also looking at the joints above and below so that we get a full picture of everything that's affecting your injury. We'll also do biomechanical assessment. So we're trying to look at the way you move and again, look at factors that might be contributing to your injury. So the treatments that I do consist of a combination of hands-on manual therapies with some exercises and rehab exercises. So manual therapies may include massage techniques, myofascial release, cupping, blading, and joint mobilizations. And then the rehab exercises are designed so that you have something you're able to do at home to try and take care of your injury from home as well. These exercises look at increasing strength and increasing kind of neuromuscular control, because we always want to look at preventing future injuries and look at the factors that might have contributed to this injury as well. We'll also look at your biomechanics and look at correcting your biomechanics, because we want to get to the root cause of what's causing this injury rather than just treating your symptoms. So some of the most common concerns that bring people to Preventous for an athletic therapist are injuries, of course. I work with a lot of knee osteoarthritis, hip osteoarthritis, piriformis syndrome, tennis and golfer's elbow. And then I also work with a lot of people who, again, just have general pain or want to work on improving their balance or improving core strength, doing a lot of postural corrections. So trying to kind of get us out of this, typical head forward posture from working all day. I also see people here for fitness assessments and looking at improving their fitness in whatever area they may be lacking a little bit, working with them on their exercise programs and strength programs, and trying to create a holistic program that's going to benefit them and get them to where they need to be. So for a fitness assessment, what we're looking at is a few factors of fitness. And fitness in terms of overall health, not so much athletic performance. So we're looking at your aerobic fitness and your musculoskeletal fitness. So some tests that we'll do include either a treadmill, walk, or run. We'll have a look at your grip strength, upper body strength, leg power, core strength, balance, as well as joint health. And those will start by chatting for a bit, getting to know what you're currently doing, what your lifestyle looks like. So after we learn a bit about you and what your current activity level looks like, Then we'll get into the actual assessment piece and we'll put together a plan for you. So you'll come back in and we'll go through the results as well as recommendations that I've made based on your goals as well as the results from the fitness assessment. From there, together we work to create a plan to get you up to where you need to be and try and reach your goals.